Hi, my name is Aisha Kamal. I am PGY2 at DMARD Internal Medicine. We have a case of bowel perforation in patient on anti-rheumatic treatment with Intaracept, exacerbated by recent use of corticosteroids. In United States, approximately 1.3 million adults suffer from rheumatoid arthritis. It represents 0.6% to 1% of the adult population. It manifests with wide array of symptoms leading to a multi-organ involvement and a high degree of disability. Medications used to treat rheumatoid arthritis include NSAIDs, glucocorticoids, DMARDs, and biologic response modifiers. While these therapy options have mitigated the disability associated with RA, all these agents have potential for side effects, including serious effects like GI bleeding and perforation. Here we have a case of GI perforation that has been attributed to the use of Intaracept in combination with glucocorticoids. We have a 64-year-old female with long-standing history of RA, diabetes, diverticulosis, and hypothyroidism. She presented to the hospital with severe epigastric abdominal pain, which started 2 days ago. On physical exam, she exhibited tenderness and rebound guarding at mid-epigastrum. Her labs showed leukocytosis of 14.9 and her ESR was elevated. On CT imaging, as you can see on the side, she had severe inflammatory changes in the abdomen with pneumoperitoneum as well as organizing fluid collection. Patient underwent an exploratory laparotomy with partial colectomy and colostomy placement. Surgical findings included peritonitis, perforated sigmoid colon, adhesions between sigmoid colon and the right fallopian tube, and large jejunal diverticulosis. Post-op course was complicated by sepsis and acute respiratory failure, required mechanical ventilation. Patient was extubated post-op day 7 and her colostomy was later reversed. Upon further review of the history, it was found that patient was on Intaracept for RA for last 5 years, and recently she was admitted to the hospital for COVID-19 pneumonia and received high-dose steroids during her stay. Intaracept is a biological TNF inhibitor used to treat a wide variety of autoimmune disorders, including RA. It binds both TNF alpha and TNF beta receptors to inhibit inflammatory response in joints and skin that is characteristic of these disorders. The drug can be used as monotherapy or taken with other immunosuppressants such as methotrexate. Long-term use can lead to bowel wall thickening and mucosal damage, which can be further exacerbated by concomitant steroid use, especially in patients with predisposing conditions like diverticulosis. The hypothesis is that the drug inhibits host defenses and facilitates an imbalance between protective and aggressive factors at the weak mucosal barrier of the diverticula. There was an analysis by Curtis MD, which included 140,000 RA patients, which demonstrated that the incidence of GI perforations was 3 times higher while taking TNF inhibitors in combination with a steroid as compared to monotherapy with TNF inhibitors. So the conclusion is that physicians should be cognizant of the gastric side effects of combination therapy with TNF inhibitors and glucocorticoids while managing patients with autoimmune conditions. Thank you.